Thanks, Rachel. Hi, everyone. My name is Julia Murphy. And like Rachel said, I'm the instructor of Forest Ecosystem Management and Planning, which is the capstone class for the Ecosystem Management and Forestry major. We're super lucky to have really great diverse professionals and experts for our William Main seminar this year, and giving us a chance to really examine some current critical issues facing the intersection of forest health and human health in California. And so anyone who was in California during 2020 knows the importance and relevance of smoke if you woke up that day and couldn't see the sky and were scared of the apocalypse. So wildfire smoke is rapidly becoming a regional air pollution issue that threatens decades of air quality improvement. While there are interventions available to reduce wildfire smoke, current policies make it difficult for state and federal authorities to use those methods. Today's talk will address the changing risk and societal burden of wildfire in the United States and the implications for air quality management. Our speaker today, Sam Heft-Neal, is a research scholar at the Center on Food Security and the Environment at Stanford University. Sam is working to identify the impacts of environmental changes on health and agriculture around the world. His recent work combines household surveys with remote sensing data to examine environmental drivers of child health. Sam holds a PhD in agricultural and resource economics from the University of California, Berkeley, and a BA in statistics and economics, also from California, UC Berkeley. So thank you, everyone. I'm excited to introduce Sam Heft-Neal for his talk today called Managing the Changing Risk and Health Burden of Wildfire Smoke in the U.S.
Great. Thanks a lot, Julia. Happy to be here today, talking to everyone. And as she mentioned, I'll be talking about some wildfire smoke issues that we've all been experiencing. This photo is from Southern Oregon, where these people decided they could play golf through the wildfire. I would not advise that, but I think smoke has been at the forefront of all of our minds, so happy to be here discussing this today. So over the last couple of decades, air quality has generally improved a lot in the United States. This is largely due to some of the federal policies, the Clean Air Act. And so we've seen PM 2.5, which is one of the main pollutants we care about for health issues, has gone down on average from around 14 micrograms per cubic meter all the way down to below 8 in the last, between 2000 and 2020. But you might notice that when we divide up by region, each color is a different region here. You can see that the West and the Northwest have some spikes in recent years where PM 2.5 has gone on off trend. And especially since 2015, we've started to see some flattening and even some increasing in certain parts of the country. So why is that? Well, during those same period, we've seen a big increase in wildfire. The top line shows the national trend and the bottom line shows California. You'll notice that 2020 is a special outlier in terms of the amount of burned area. And so with fire comes smoke. So if we look at the number of days where we had smoke overhead in different parts of the country, you'll also see that we've seen a big increase over the last 15 years. So that now on average, there's 40 or 50 days with smoke per year, especially in the West and the Northwest. And so we know that wildfire smoke has a bunch of bad stuff in it. It has PM 2.5, and it has ozone, it has nitrous oxides, it has a bunch of things that have been shown to be correlated with bad health. So what should we do? So today I'm going to be talking about a number of different studies that our group's been undergoing that address a number of these different facets. So first I'll talk about estimating the air quality effects of wildfire smoke. And then we'll look a little bit at who is exposed to smoke. So is it the same as other pollutants? Is it different? Are there specific groups that are particularly vulnerable or particularly exposed to smoke more than other things? And then after that, I'm gonna look at health responses, both in terms of what's known and what's unknown. And then finally, I'm gonna talk about some of the policy options for mitigating health impacts from smoke. First up, air quality effects of wildfire smoke. So there are a number of different ways to look at the air quality effects from smoke. The traditional way to do it is with chemical transport modeling or dispersion modeling. And there are a number of these different models. The EPA has their favorite one, CAL FIRE has their favorite one, but all of these models share in common this idea that you can model the physical environment, and with understanding of atmospheric chemistry, you can use information from the ground about where stuff is being emitted, and you can actually model where it's going to be transported around the country and around the world. So one of the big advantages of this is that you have this link between where the fire is occurring and where the smoke is being transported. And so if you want to look at specific types of fires and how much smoke they're emitting or where the smoke is going, that's really useful. But there are also some disadvantages. In particular, it's really computationally expensive to run these models. So generally, people don't generate long time series. You get a study that has a couple years maybe, but you don't have like 20 or 30-year studies usually with these types of models. And then wildfires in particular are tricky. These models are used for all types of air quality modeling, but wildfires are tricky because one, it's really important about the plume injection height. So when smoke is released from a fire, it goes up initially, but eventually it starts going horizontally. And where in the atmosphere, how high up it starts going horizontally makes a big difference in terms of how far it's transported. But that's a big source of uncertainty that's hard to observe. And then in addition, inventories, so how much stuff is eligible to be burned, that's a really important input into these models, and it's really uncertain. So to illustrate some of these uncertainties, this is from a recent paper in 2018 that evaluated the importance of emissions inventories in these types of models. So all of these maps on the left column are showing modeled PM 2.5 from wildfires in 2011. The right column is showing ozone. And so this is the results from the same model 3 different ways. And each time it's just using a different source of emissions inventories. And you can see that, for example, in the top left, if you use NEI emissions inventories, then you have very large estimates for how much PM 2.5 from wildfire smoke occurred all over the Southeast. Whereas if you use the GFED emissions inventories, you have about 5 or 6 times less PM 2.5 from smoke predicted from the same model in the same year, just because we don't have a good understanding of exactly what the real inventories are. And so overall, this paper finds that with different emissions inventories, the national average of PM 2.5 from wildfire smoke varies by about 3 times. And then locally in places where wildfire smoke is even more important, the difference can be up to 20 times. So this is a big problem because it creates a lot of uncertainty about what exactly is going on. So one alternative approach that we're interested in is, can we actually see how much smoke is in different places in satellites? So this Sentinel-3 image from August of last year shows what the smoke looked like during the fall wildfires. And so we think that there's a possibility that you can infer concentrations directly from satellites. And fortunately, NOAA has been thinking about this for a long time. And so they've actually developed these polygons of smoke plumes. They're literally hand-drawn multiple times a day, every day since 2006. It's unclear to me why they're still hand-drawn as opposed to automated, but there are still these analysts who every day look at these 3 or 4 different images per day and figure out exactly where the boundaries of these smoke plumes, and then they also assign a density measure. So how thick do we think the smoke is here? So what do these data look like? So here's daily smoke plumes for 2018. Each day I've just plotted the smoke plumes that are drawn for that day. So you can see in March, a lot of the fire activity is in the Southeast, but by the time we get to the fall, we're going to see more and more in California. Every once in a while, a fire comes in from Canada and brings a big plume across much of the US. Now we're in July and you start to see some really big California fires are contributing to smoke all across the country. And so one of the shortcomings of these data sets is that the plume boundaries are imprecise. You know, they're hand drawn, but we can't tell, like you probably can't physically tell if you're on one side of the boundary or the other, if you're on the ground. And then the other big issue is that they don't tell you anything about the height of the smoke. So if you're looking from above at a satellite, you can see where the smoke is, but you don't necessarily know if it's on the ground or if it's really high up in the atmosphere. And so that's a big challenge in terms of what you care about is pollution on the ground, then you'd ideally want to be able to differentiate between smoke that's really high up and smoke that's really low down. But some of the advantages of this approach are that we don't need to depend on emissions inventories to get the chemistry right. We can just look from satellites and see where we see smoke. And then it makes it really straightforward to test statistical models and use ground monitoring PM2.5 data to validate these models. And so we may not understand all of the mechanisms that are going on, but we can at least have all of this data and we can test how well do the data actually predict PM2.5. But with this approach, we cannot easily link fires to smoke plumes, and it's unclear, as I mentioned, whether the boundaries are precise. So using this information, we built a model of PM2.5. And so it includes the smoke plume locations that I just showed. It includes locations of fires also detected by satellites, AOD, which is aerosol optical depth. And the way that works is satellites bounce light off the ground, and then depending on how much stuff is in the air, you can tell how much light is refracted back. And so from that gives you a proxy for how much stuff is in the air, which is not the same as PM2.5, but allows you to get an idea for the density of the smoke and for the volume of PM2.5. And then from ground, we have the EPA daily monitors that measure PM2.5. And we think this is the most reliable source of PM2.5 data. So we're going to try and predict it using the satellite data. We're assuming that the plume data are accurate and that also density of smoke is a function of distance to source fire, which may or may not be true, but it looks like in the data that appears to be true. So again, we have this model. The outcome that we're predicting is PM2.5, and then the inputs are all of these fire and plume information, as well as a bunch of other controls. And so with this type of statistical model, as I mentioned, it's really great that it's easy to validate. So one thing we can do is we can randomly select 75% of the data, estimate our model, and then see how well the model predicts the PM2.5 values in the 25% of the data that was held out. And so in doing this, we can see how much of the PM2.5 variance we explain. And here we get an R-squared of 0.6, so we can explain about 60% of the variance in PM2.5. And so obviously 40% is still unexplained, which is not perfect, but it's pretty similar to some of the other models that have not been concerned with wildfire, but just trying to predict PM2.5 in the US. So overall, we're satisfied with the performance. And then we were pleasantly surprised to see that the performance didn't really vary very much with different controls, as long as we included the same smoke and fire measures. So once we have this model that predicts PM2.5 as a function of smoke and a bunch of other stuff, then that gives us the opportunity to try and look at how much of the PM2.5 is actually coming from smoke. And so the way that we did that is that we first evaluate the model at all the observed values of smoke and observed values of fire, and that gives us an estimate for total PM2.5. And then if we want to look at a hypothetical scenario where there's no fire and there's no smoke, we can set all of those values in our model to 0, and then we can repredict PM2.5. So now we have two PM2.5 estimates. One is for total PM2.5, which includes all the smoke and fire, and one is absent all of that stuff. And then if we look at the difference between those two, that gives us an estimate of how much PM2.5 is actually coming from smoke. So when we do that, we can divide over 2 decades and we can see how it's changed. So in 2006, 2008, we saw there's some areas where you have pretty big PM2.5 from smoke, especially Northern California and Southern Oregon. We see about 4 micrograms per cubic meter. Recall that the average PM2.5 in 2005 was about 14 or 15. So that's a pretty big increase in terms of percentages. But by 2016, 2018, we see much more of the Western United States has large increases in PM2.5 from smoke. And if we want to look at the time series of those same estimates, we can look at it both in terms of value of PM and in terms of percentages. So this top left is the overall increase of all PM from any source. And I showed this earlier. Again, you'll recall that it's declining until the very end. In the last couple of years, it's really increasing. And then if we want to look at the percentage of PM2.5 that our model says is from smoke, that's increasing a lot, starting at about 5% in 2006 and going up to about 20% of total PM2.5 across the entire United States by 2019. And then in the Northwest and the West, in these really bad fire years, we actually estimate that upwards of 40% of total PM2.5 in that year comes from wildfire. So that's a gigantic increase in PM that's coming from a source that air quality monitors haven't really considered thus far. And so this last plot is just the time series of the two, the counterfactual that we estimated where you take smoke out of the model and then the observed values of smoke. And so the difference between here is how much PM is coming from smoke. And in some years where there's not as much fire, that difference is pretty small. But another year is like 2018 was a big fire year. So we see a pretty large difference between how much PM we have with wildfire and how much PM we would have without it. So to summarize the air quality part of the discussion, we use satellite data, which allow us to measure smoke over large spatial scales daily over the last 15 to 20 years. And then we developed a statistical model, which we think does a pretty reasonable job modeling PM2.5 from smoke. And what we find is that while there's been a decline in recent decades in overall PM2.5, this trend seems to be reversing in the West, largely because PM2.5 is contributing big portions of PM in fire years. And so again, on average, we're seeing upwards of 20 to 25% of national PM from wildfire smoke. And in the Western United States, we're seeing upwards of 50 in really bad fire years. So that's a big contribution that wildfire is giving to overall pollution. So the next question we're interested in is, so who is exposed to smoke? Now, we know that certain regions are more affected than others, but we also want to know if certain populations are exposed more than others. And so in the environmental justice literature, looking at PM2.5 exposure from all sources, there's a pretty established pattern that low-income households and then certain racial groups are exposed disproportionately to high levels of PM2.5. And that's both because low-income groups live in places where housing values are lower. And so companies are more likely to build, say, the Chevron refinery in Richmond rather than in a wealthy city. And at the same time, when property values are lower, people are more likely to be forced to move into areas that are higher pollution. But we don't really have a good understanding of how those relationships are with smoke PM2.5. So if you look at the overall PM2.5, so this is PM2.5 from all sources, distribution in California, you can see the areas that have the highest PM are the Central Valley, which is largely agricultural machinery and such. And then there's also some weather patterns that create inversions that keep pollution really close to the ground. Los Angeles, you see a lot of traffic pollution. And then parts of the Bay Area, you also see high levels of pollution, largely from traffic as well. But what if we make the same map looking at smoke? Well, it's a very different pattern. And what we see with smoke is that it's the northern part of the state that has the highest concentrations of smoke. You see a little bit over here, but for the most part, Los Angeles has relatively low smoke levels, as do the Bay Area. And so you get a very different population that's exposed to pollution than we normally think about when we're talking about PM2.5. And so as I mentioned, from the environmental justice literature, we know that exposure to PM2.5 varies by both income and racial groups. So here I've plotted each row is a different income decile. So row 1 is people in the lowest income decile, row 10 is people in the highest income decile. And then I've also plotted different groups. So this is non-Hispanic whites, Hispanics, non-Hispanic blacks, non-Hispanic Asians. And then each cell shows the average PM2.5 exposure for that group in California. So you notice that the lowest income group, no matter what racial group or ethnicity people are from, is exposed to the highest levels of PM2.5. And at the other end of the spectrum, high income, regardless of race, is exposed to the lowest levels of PM2.5. So what if we make this same figure for smoke? Well, it's quite a different pattern. Instead, now we see that white households are disproportionately exposed to smoke. And again, if you look back at the smoke map, a lot of the northern parts of the state where they have the highest smoke exposures are primarily white areas. None of the black households are in the highest smoke category. And then you also don't see this protective nature of income like you did for PM2.5. Even some of the wealthiest households in different racial groups are exposed to moderate levels of smoke, whereas none of the wealthiest households are exposed to high levels of PM2.5 from other sources. So this is a pretty fundamentally different pattern of exposure than we've been seeing from other sources of PM in the past. Another way to look at this is nationally now instead of just for California. and we can just plot from our model the predicted PM2.5 overall as a function of the percent of a census tract that is white, and we see an overall decline. So as census tracts get more white, we see lower overall PM2.5. But if you do the same thing for smoke PM2.5, we see the opposite, where census tracts that are larger majority white are actually have higher PM2.5 from smoke. So that's all talking about ambient exposure, outdoor exposure, and we think that might be missing an important part of the story. Why? Because what percentage of time do Americans spend inside? Well, on average, it's about 70%. It varies state to state. It's a little bit lower in California than some other places, but pretty much everywhere people spend the majority of their time inside. So how do we think about people spend their time indoors when we're talking about pollution, which we mostly measure outside? So the amount of time spent inside also varies by group. The one thing I want to point out is that for people 65 and over, they spend more than 80% of their time inside, which is much higher than all the other groups. And we think that's important because people who study PM2.5 effects from health consistently find that people 65 and over have the largest impacts from pollution. So if people in that age group are going to be spending most of their time inside, then we should care about how much of the pollution actually comes inside. So we have an ongoing project looking at this. Many of you may be familiar with the Purple Air Monitoring Network, low-cost pollution monitors that people can set up in their homes. They report data to this public system that can be downloaded by researchers. And so all of these locations on the map are showing the locations of homes with indoor pollution monitors. And so what that allows us to do is to see hourly PM2.5 concentrations inside over the last, monitors come on and on different times, but since about 2016. And so what we did was we took all of these indoor monitor readings of hourly PM2.5 and we matched them to the nearest outdoor monitor so we can estimate the relationship between indoor and outdoor pollution each hour. And so we have a bunch of controls, but this model lets us get an estimate for the rate that pollution moves from outside to inside. And so we call that the infiltration rate. And what that means, the interpretation is for every 1 unit of outdoor PM2.5, how much does indoor PM2.5 increase by? So here, an estimate of 1 would indicate that there's basically no barrier between outside and inside. Every unit of outdoor PM goes straight into a unit of indoor PM. And here 0 would indicate that there's perfect protection. No matter how much pollution outside goes up, indoor pollution never changes. So maybe you have great doors and windows, you never open them, and you have a filter inside that filters the air constantly. So this is the distribution that we get. These are all estimates across all the different monitors in the US. So on average, we see our estimates about 0.2. So again, that indicates that for every 1 unit of outdoor pollution, we see about a 0.2 unit increase in indoor pollution. But these estimates vary a lot by different factors. So for example, if we think about how infiltration will vary with temperature, you might imagine that when it's cold, people are more likely to have their windows and doors closed. And I guess taking a step back, what do we think infiltration will depend on? It's a combination of engineering in the house and behavior. So if your house has really good double pane windows and doors, and you have better insulation, then you're going to have a lower infiltration rate. At the same time, if you keep your doors and windows open all the time, you're going to have a higher infiltration rate. And if you have an indoor air quality, a filter, then you're going to lower your infiltration rate. So getting back to this plot, if we look at as a function of temperature, how much does infiltration vary? Our hypothesis was that it was going to be higher on hot days where people are more likely to have their windows open. Again, most of our samples in California, most people don't have air conditioning. So you would think that people would behave in a way that allows for infiltration on hot days. And on cold days, we expected to see less infiltration because people are just more likely to keep things insulated to keep the heat in. And sure enough, that's what we find. The infiltration rate on really, really cold days is about 0.1, and it's almost double that on really, really hot days. So again, we think we're picking up this behavior where people change how much their windows and doors are open. Similar for seasons, you could imagine summer would be the hot time when people would have their windows and doors open. Winter would be the cold time, and sure enough, that's what we find. But what we're really interested in is how people respond during wildfire times. So we also split up the outdoor PM by PM level. So here, the x-axis is telling us how much outdoor pollution there is at any given time. And then the y-axis is telling us what the infiltration rate is at that time. So here, 0 to 10 indicates a really, really low pollution time. And over 100 is probably a wildfire in California. It's a really, really high pollution time. So would you expect pollution to come inside more when there's a lot of pollution or when there's a little pollution? I wasn't sure, but what we find is that people are much less careful when there's little pollution. And so when there is a wildfire, I think people turn on their air filters. They're very protective of not opening windows and doors. And so we actually see the lowest infiltration rate when pollution outside is really high, and a much, much more than double higher rate when pollution is really low. So again, what we really care about was how does wildfire smoke get inside the homes? So one way we can look at that is we can just compare the indoor and outdoor readings during a specific wildfire period. And so we did that by looking at the indoor air monitors that are in the Bay Area. So each one of these dots indicates a home that has a purple air indoor air monitor that we've been able to estimate the infiltration rate for. And so we did this, and then we divided all of the households into low infiltration and high infiltration. So this is just dividing the households into 4 groups, and the lowest quartile of infiltration we called the low group, and the highest quartile of infiltration we called the high group. So one thing that we were a little surprised about is how mixed together the different households are. I would have thought it would have been a little more spatially continuous, that certain neighborhoods have certain characteristics. But I think what this indicates is that the behavioral response part is really important, whether or not you have an air filter, how you deal with your doors and windows, and that's going to vary between neighbors. So with these monitors, we decided to look at what does hourly PM2.5 look like, both indoors and outdoors, during a really big wildfire period. So this is fall 2020, last year when we had these really big wildfires. What did PM look like? So this is outdoor PM, and these are each blue lines corresponds to a blue dot on the map. So outdoor monitors in these areas, we see there's nothing really going on, pretty low pollution in early August. And then we had these giant fires, and all of a sudden outdoor pollution went above 300 micrograms, which is like unheard of in California. And again, we had a second spike in September before everything calmed down again. So on average, you see all of our outdoor monitors in these blue locations had these around 100 during the August spike, and then around 250 to 300 during the September spike. Now, if we plot the hourly concentrations for the red monitors that have high infiltration, we see pretty similar concentrations outdoors, which makes sense. These are only divided up by their infiltration rate, so the outdoor concentrations are basically the same. But what if we look at the indoor concentrations? So again, these are the indoor concentrations for the low infiltration households, and we see that on average, the PM indoors stayed below 20. Which is quite reasonable, especially when you have these big spikes up to 300. But what about the high infiltration households? Well, the indoor pollution for those households went extremely high. We had average indoor pollution over 100 during the September spike. And so what this indicates to us is that most health studies, our own included, just look at outdoor PM2.5 and treat that as the exposure that we care about. But people spend most of their time inside, and how much PM2.5 gets inside seems to vary a lot based on housing and behavioral characteristics. So infiltration rates are an important source of unobserved heterogeneity in health impacts, because even though neighbors may be exposed to the same outdoor PM, they could have very different indoor PMs, which is where they're spending most of their time. So what do we know about wildfire smoke and health? Well, we know that PM2.5 is really bad for our health. If we're not thinking about wildfire smoke, there's been 20 to 30 years of epidemiological studies that relate PM2.5 exposures to different health outcomes. And it's bad for everything from premature death, asthma, depression. It's been linked to so many different things that it's very established relationships. But one key source of uncertainty here is that we don't necessarily know that wildfire PM2.5 has the same health effects as other sources of PM2.5. That's a big open question. There's been a lot of research on this, but it's really mixed about whether or not the effects are different. But one way to look at wildfire health effects is to just look directly at smoke exposures using the satellite data if you want to ignore whether or not PM has the same effects. So I'll show you examples of both. If we want to look at the health burden from smoke, then there are a couple things we need. We need population data, which is easy to get in the US. We need a measure of exposure across the population. So this could be one of the modeled sources of PM2.5 from wildfire, or it could be something like our direct smoke measures from satellites that we looked at earlier. And then you need some response that measures the change in health per change in exposure. So one way to do this would just be to use existing estimates. Now, most existing estimates are for PM2.5 from other sources. They're not wildfire specific. So if you think that wildfire PM has the same effect as other PM, then it's easy to apply a number of these established estimates. But if we don't trust those, we can also estimate a new response with our own data, trying to just look at wildfire smoke or wildfire PM. So let's say that smoke PM is the same as other PM, then we can look at the observed exposures and we can apply known responses for other sources of PM to get effect sizes. So this just shows the same wildfire period we looked at earlier, and these are PM monitors in different cities along the West Coast. So this is daily. You can see that Portland in particular had daily PM above 300 during parts of September 2020. And so one thing we know is that elderly people or people in certain age groups are more susceptible to deaths, early premature deaths from wildfire or from smoke in general. So in particular, there's one really great study that used this giant Medicare data set. They had like 50 million observations where they could see daily outcomes for most of the Medicare sample. And they related this to random changes in pollution in order to get an estimate for how much each additional unit of PM in a day increases the risk of death for people over 65. So again, if we think that PM from smoke is the same as PM from other sources, then we can just apply that relationship to these observed PM concentrations to get the number of excess deaths for people over 65 each day during the wildfire period in 2020. And when we do that, we find that in Portland, for example, we would estimate over 100 deaths for people over 65 on one bad smoke day. In Seattle, it would be about 75 deaths on the worst day. San Francisco would be about 150, but overall, these are large numbers of deaths due to smoke PM because these PM concentrations that we saw are just huge. Now, maybe we don't believe this. This is more of a back of an envelope calculation than a real analysis. It could be that people behave differently when PM is high. These relationships are estimated mostly on lower concentrations. They didn't have any 300 microgram days in their sample. It could also be a nonlinear relationship where the effects are smaller for each additional unit of PM over a certain threshold. And it could be that wildfire PM and other sources of PM have different health effects. And then also could be just the people who are exposed to wildfire PM is different from other PM. And so maybe the sample that we drew the Medicare estimates from doesn't apply to our wildfire sample. So if we don't want to do this kind of back of the envelope calculation, what can we do a little more systematically? And so what we've done is we've looked at a different group that we know to be especially vulnerable to PM2.5, and that's pregnant women. And so in California, working with some collaborators at the Stanford Medical School, we were able to get data on every birth in California from 2006 to 2012. We can see people's locations of residence, and we see a bunch of information about the pregnancy, how long it was when the child was born, birth weight. And so what that allows us to do is relate the smoke plume data from the satellites directly to the risk of preterm birth, which has an established relationship with PM2.5, but hasn't really been looked at with smoke specifically. So we have this model where we evaluate the risk of preterm birth as a function of smoke and then a bunch of household and neighborhood controls. And what we do is we estimate a separate model for the entire pregnancy and the one that splits the effects by trimester. When we look at the entire pregnancy, we see about a 0.4% increase for every day that the pregnant woman was exposed to smoke. So that's small if you only have 1 day exposed to smoke, but if you have 20 days, then all of a sudden we have a 5% increase in the risk of preterm birth. And that's 5% relative to whatever that person's baseline was before. So people who are more at risk for preterm birth, we see larger increases in preterm birth for them when they're exposed to smoke. And when we split it by trimester, we see the effects are largely coming from the second trimester with small effects in the first trimester. And then by the time we get to the third trimester, we don't really see anything. We also split this by group. And as I mentioned before, the exposure to smoke is a lot different than it is for PM2.5, but we also care for 1 unit of smoke PM2.5, is the response different among different groups? So often when people talk about the burden of pollution, they conflate these two ideas. One is who is exposed to what, and the second is for each unit of exposure, do people have different responses? And so we try to separate that out here, and here we're just looking at the response per unit of exposure for different groups. And when we split it up by income, we actually don't see income effects, which is different than what most people have found for other sources of PM2.5. Typically, higher income households are protected from PM2.5 effects, but here we find pretty similar effects across the entire income distribution. Similar for race and ethnicity, we don't really see different effects. We see slightly bigger effects for white mothers, but not statistically distinguishable for effects for other races and ethnicities. The one place where we do see really big differences is on baseline smoke exposure. So what does this mean? Here, this top group is the group of mothers who live in places that are rarely exposed to smoke. And this bottom row is for mothers who are exposed to smoke constantly. And so what we find is that the mothers that are rarely exposed to smoke have much larger effects than for 1 additional day of exposure than mothers who are exposed all the time. And so why would that be? One reason is that we might just be picking up the really big fire effect here, where people who are not exposed to smoke very often only get exposed when there's a giant fire event. Whereas people who are exposed regularly, they get exposed from all these little fires as well, which may not matter as much. And if only the big fires matter, then that would be consistent with what we find here. But that's just suggestive. We don't really have enough information to say for sure why we find these really strong gradients in baseline smoke exposure. So to summarize, it's still unclear how PM2.5 from smoke affects health, whether it's different from other PM. There's one pretty good study looking at this that was released just a couple of weeks ago. And I think they do a really good job of estimating PM2.5 from wildfire health effects. They find pretty strong effects of premature mortality. I think they have less credible estimates of the non-wildfire PM estimates, so it's hard to know what to make of their comparison. But I think all evidence points to the fact that there's definitely very bad health effects from wildfire smoke, but we still don't know exactly how it differs from other types of pollution. And then we also can avoid this assumption by just looking directly at the smoke exposure using satellite data. And in doing so, we find that smoke is strongly associated with preterm birth in California. Okay, so that's a lot of bad stuff that happens when you're exposed to smoke. What can we do about it? Well, it's complicated, as you might expect. It requires coordination between many different types of public agencies and private landowners. And then there's also some complications that are always associated with pollution, like smoke does not respect administrative boundaries. So if you look at some of the models that connect smoke to fire, you can see that in many states, like in parts of Washington, you get a lot of smoke PM2.5 from Canadian fires. So if you want to limit that, how do you require Canadians to manage their forests in a certain way to limit smoke pollution? At the same time, California fires cause smoke pollution in a lot of other states. So you have these trans-boundary state issues and transnational boundary issues that make attributing the responsibility to these things difficult. And then the Clean Air Act, which is the #1 contributor to the reduction in PM2.5 over the last 30 years in the US, is really poorly suited to address smoke. So it treats wildfire as an exceptional event, which means that when they're evaluating whether or not a jurisdiction is following all the rules and reaching attainment of keeping pollution below a certain level, they treat wildfire as an act of God. It's not your fault. So no matter how much wildfire pollution you got, you can still reach attainment. But at the same time, they do not treat prescribed burns that way, because prescribed burns are human made. And so those count against you when you're measuring attainment. And so what that does is it creates a really strong incentive to never do prescribed burns, because every time you do a prescribed burn, it counts against your attainment. And when a wildfire happens, there's no effect on your attainment. And when you are out of attainment, a lot of bad things happen. Like you can't give permits to do certain types of industrial production because it adds to the pollution. You get fines. It just causes a lot of headaches for regulators. So they like to just ignore this issue and I guess pretend that it's going to go away, but it's not. So just to summarize, there are a number of different ways that we could think about trying to limit the effects of health impacts from smoke. So this diagram, I'm going to go through a few different options. So just to summarize here, we start with fire. The fire creates smoke. The smoke has pollution in it, which is transported to places where people live. Maybe that's nearby, maybe it's far away. People who are outside are exposed to the smoke, and that creates bad health impacts. Pollution also filters into people's homes, and then people who are inside are also exposed to that, and it creates bad health impacts. So if we want to limit the health impacts from smoke, what can we do? Well, one option would be to prevent fire. I think many of you here know much more about this than me, so I'll defer to you, but it seems like a complicated issue, and prescribed burns can be effective, but there's still a lot unknown. How much do prescribed burns reduce the probability, size, and volume of smoke produced in future fires? How much would it cost to do prescribed burns at scale? If we're going to scale up to really limit the wildfire in future California, it's going to cost a lot. And then what are the health effects of prescribed burns? I think we don't necessarily know if smoke from prescribed burns is different from smoke from wildfires. It might be better for you because it's not burning up houses and chemicals, but I think that's a big unknown as well. You could also imagine a fuel management strategy. So fuel management could help you reduce fire, but even conditional on there being a fire, fuel management could help the fires that exist produce less smoke. And so Bill put together these estimates with some collaborators looking at the amount of carbon that's released per acre of fire burned by management practice. And I think many of you in the class have already seen this data in a different format, but what you'll notice is that the national forest reserves or other forests have substantially more smoke produced per acre burned than privately managed land. And that's just because of the way that fuel is managed and how much fuel is on the ground that can actually be burned and turned into smoke. So fuel management is not only for preventing fires, but it's also for reducing smoke when there is fire. Another potential strategy could be fire suppression strategies. So once there is a fire and the smoke is being produced, can firefighters manage the fires in a way to limit downstream smoke impacts? Right now, fire suppression understandably focuses on protecting lives, homes, and structures. I think most people would agree that lives should be the #1 priority. But after that, if you're deciding between protecting structures where nobody's around, could you think about trying to manage fire in a way that it reduces the downstream smoke impact? I think it would be really tricky. You'd have to have a lot of really good information about how the fire is going to move and the smoke's going to move. Maybe it's not feasible, but that would be one option for trying to manage the downstream smoke impacts. Once the pollution does reach the city, if you want to limit outdoor exposure, there's a number of different ways you could go. One thing California is considering is, should there be a regulation about closing schools on days when smoke is above a certain level? So you can imagine sending kids home because at least inside people are going to be exposed to less smoke than they would outside. Cal OSHA is also considering requiring employers to provide masks to construction workers and agriculture workers and other people who are outside during wildfire events. And it might also be necessary to have some educational campaigns. If people don't think smoke is bad for them, that is going to lead to some suboptimal decision making. So maybe it's necessary to remind people that smoke does bad things to your body. Once smoke comes to the house, you could imagine different strategies to limit the amount that gets inside. So one is just to encourage people to have air filters indoors. Another one that we're excited about thinking through more carefully is energy efficiency investments. So in California, normally energy efficiency is considered less important than in places like the East Coast, just because it's more temperate weather. So you don't have the huge heating bills. Most people don't have air conditioning. Typically, when you're thinking about a cost benefit of improving energy efficiency in your home, it's maybe putting in new windows or improving insulation. And you do that because you want to lower the cost of your energy bill during extreme weather. But what if another benefit of improving insulation is that you no longer get wildfire smoke in your house? So I think that's a big, potentially undermeasured benefit that could maybe change the cost benefit analysis for a lot of people. And then lastly, if everyone does get smoke in their lungs, then you could always improve healthcare access, but that's a whole nother talk. So wrapping up, wildfire smoke is increasingly central to air quality issue. Its indoor exposure is poorly understood, but likely critical to understanding impacts and disparities. Again, I want to reemphasize that everyone, including us, has only really looked at outdoor exposure so far. And it seems like the amount that people are actually exposed to inside depends a lot on your behavior in your household. So that makes a big difference. Patterns of smoke exposure appear to be quite different from other pollution sources, which has implications for both how people are affected and who's affected. And then we still don't know whether PM2.5 from wildfire has the same health effects as PM2.5 from other sources, but smoke exposure is associated with bad health outcomes. And then lastly, effective air quality management now requires wildfire management. There are opportunities to intervene, but everyone has pros and cons. So lots of unknowns, lots of opportunities for researchers to make important contributions. Thank you.
Thank you so much, Sam. That was really excellent. And I will now open the floor up to questions. Again, if you have questions, you can type them into the chat, or you can use the raise hand function in Zoom to raise your hand to ask a question. I have a few in the queue already, so I will start with those while other folks type theirs in. So Sam, this question comes from Rick Satomi, who's with Cooperative Extension. He asks, does the demographic data include individuals from the wildland urban interface, or is the data predominantly based on urban populations? And did you look or find or see any difference between these two populations in terms of exposure?
So the data that I showed is for every census tract in California, so it covers everywhere, but we haven't divided by wildland urban interface versus just urban areas. I think that would be interesting. That's something we can do. I would just, yeah, I'm not gonna guess, but I think that's an interesting thing to look at. We can definitely do.
Great, thank you. All right. Any, I have a, oh, there we go. Okay. Oof. This is a long one, so give me a moment here. Okay. Sam, this is from Carlos Salazar. Carlos asks, China has a similar problem of excess particulate matter and pollution, especially northern China's cities. I do not know how to say this city name, but in one of the cities, a giant solar-assisted skyscraper-sized air purifier was constructed to mitigate air pollution in the city. Should areas in America with dangerously high levels of particulate matter consider replicating this technology?
Yeah, that's an interesting one. So I'm not familiar with the specific technology. I think one of the difficulties, so in China, for example, they have high PM2.5 pretty much all year round. So it makes sense to invest in something that's continually filtering the air. One of the distinctions about the California wildfire pollution is that you only really need it certain times of the year. Most of the time we have terrific air quality here. So I think it's somewhat of a different issue. I would imagine that it's expensive to build and that it would be most cost effective if you're going to be running it continuously. I'm not sure you would want to build something that complicated to only filter the air, say, 2 or 3 weeks a year. But it's an interesting option.
Thank you. Our next question comes from Julia Murphy, our capstone course instructor. And her question is about the purple air filters. She says, do you think people who buy those purple air filters are self-selecting in a way that would affect their in-home behavior exposure? In other words, are these people who care especially about air quality?
100% yes, definitely. There's very specific types of people that buy purple air monitors. It's not a random sample at all. So we're very careful about how representative the data are. In fact, we're surprised we saw so much variation in filtration. We thought it would be mostly skewed towards the lower end, just because if you look at the income, and we don't see the individual incomes, but we can look at the zip code incomes where people have monitors, and it tends to be higher income areas. So, and we can look, same thing, we can look at the demographic, and it's certainly more white and Asian high income areas are more likely to have purple air monitors in California. So yeah, and that should have been mentioned, but we don't take our estimates as representative. I didn't talk about it today, but one of the other things we're doing is working with people at Lawrence Berkeley Lab who have engineering estimates of infiltration based on housing characteristics. And then we have this CoreLogic data set that gives you housing characteristics for every building in the country. And so we're trying to develop household or building level estimates of engineering infiltration that can be estimated for every building in the country. And then we can compare that to the behavioral estimates from purple air. But that would allow us at least to have a less biased estimate for places where people are not self-selecting and having a monitor. That's a good point.
Thanks, Sam. Our next question comes from Jordan, who is a student in the forestry capstone class. Jordan asks, considering many solutions to mitigating smoke depend on bottom-up resources, do you see an increasing disparity in smoke exposure going forward? From an environmental justice perspective, how do you approach this?
That's an interesting question. So yeah, I haven't looked at how the disparities change over time, but thinking to the future, it certainly does seem like you would expect that things like buying your own air filter or doing energy efficiency investments would be something that would not be options for everyone. And so I think one thing the state can do, which they've already started a little bit, is to subsidize low-income households to improve their infiltration by doing energy efficiency investments. But even that's going to be mostly targeted towards homeowners, which leaves out a big portion of the population. So you could imagine requiring landlords to improve the efficiency or the protection of apartment buildings where people live. But yeah, I think we're just starting to understand that the smoke pollution is a distinct issue from other sources of PM2.5. And so I don't think we have the infrastructure yet to kind of address a lot of these concerns, which I think is what you're getting at, that has been set up to address PM2.5 from other sources. So I think that's going to be a big challenge going forward.
Thanks. Sam, our next question comes from Stacy Frederick. She asks, there's outreach campaigns of how do you want your smoke that try to frame prescribed fire smoke as less impacting than wildfire. Do you have any thoughts on kind of this framing of prescribed fire smoke from a health perspective?
Yeah, I think that's a really interesting and important question. We have some data on this. We're trying to look at this right now. So I don't have any quantitative answers yet, but my intuition is that yes, it would be different. I don't think it's as bad. We've done a little bit of work where you have certain monitors in California or around the US that tell you what is in the PM2.5. So it's not just measuring PM2.5, but it's telling you the composition. And when we look at how the composition changes during prescribed burn times versus during wildfire times, there's a lot more bad stuff, it looks like, in the PM2.5 during wildfire times, like these VOCs and things that you get from chemicals. So that would suggest that that it's a good campaign and that wildfire smoke is worse for you. But I don't think we have the data or the results yet to say that for sure. But preliminary evidence suggests it might be true.
And so our next question from Sabrina Chu, who is a student in our forestry capstone class, kind of expands on what you were just talking about. She asks, what work and research is currently being done to separate the impacts of wildfire PM2.5 versus normal PM2.5?
Yeah.
Why is it more difficult to determine, or I guess, is it more difficult to determine what particulates are in wildfire smoke, or have people just not done that yet?
Yeah, so it's a good question. So there's kind of two parts here. One is on the exposure side, and that's what I was just mentioning. Us and some others have started using there aren't that many of them, but the specialized monitors that allow you to tell the composition of PM2.5. I think those are going to be useful going forward to let us know exactly what's in the PM, because that's what's partly going to drive the health impacts. And so if we see very different patterns in wildfire smoke, which we expect to, and other things, and that we need to know that. The second part is estimating the response from different PM sources. And the challenge here is that it's just always a little difficult empirically to measure the health impacts from pollution. And that's because pollution is generally correlated with economic activity. So if you think about in 2020, for example, pollution went way down because less people were commuting. So maybe you see a reduction in pollution and you think, oh, great, health improved a lot because pollution went down. But at the same time, we had COVID. So the change in pollution is often correlated with things that can also affect health. And so you have to have an empirical strategy that allows you to disentangle that. And so one way to do that is to use some other outside source of variation that you don't think is correlated with health. So one common way to do this is to say, use daily wind direction. So we think that whether the wind is coming from the north or south today is not related to health, but it also changes how much PM you have that day. So you can use only the portion of PM that is changing because of the wind direction change and then relate that to health. And so what people have started doing is trying to come up with ways to do this type of analysis for wildfire smoke, like the study I mentioned that I think did a good job of this. They did exactly that. They looked at changes in wind from upwind wildfires to look at how wildfire changed your PM. And so what they didn't do was have a similar strategy for estimating the non-wildfire PM effects. So I think their non-wildfire PM effects had the same problems where it was probably correlated with a lot of things that are also correlated with health, but they did a good job of doing that for wildfire. So I think as we get more data and more specific designs that allow us to separate them, then we'll get a much better idea for whether the effects are similar or different.
And Sam, just a follow up on that question, and then Lisbeth, I'll ask your question. Is there any interest, as far as you understand, in, I guess, even looking at smoke from different wildfires? And what I'm getting at is, in some areas of California, managed wildfire is a practice that the land agency uses. But that's in very remote places where there's no structures that will be burned. So just wondering, if there's interest in kind of discerning those as well.
Definitely, there's a lot of interest. I think the challenge here is that you need a way to link the fires to specific smoke plumes. So as I mentioned, our method is not great at that. We're working on that part, but the models do a much better job of that. But they have these other issues of whether or not you trust the inventories. But I think if we could have reliable links from smoke to fire, then it's something you could do. The other challenge is that oftentimes you can see in the satellite images that plumes from different fires combine, and then it's hard to know which smoke the fire is coming from or which fire the smoke's coming from. So I think you'd want to do it in specific instances where that's the only fire around, and so you'd know that the plume is coming from that fire. Because if you look at during like a big wildfire season, it's really hard to disentangle which fire each part of the smoke is coming from.
Thank you. Our next question now is from Elizabeth Ortiz. She is a student in the forestry capstone class. She asks, with respect to your own investigations, what are existing methods for low-income neighborhoods to limit their PM 2.5 air exposure in the short terms? Specifically, any new innovations or anything like that that you have come across?
Well, I'm not sure, it's not new, but I would say the cheapest, simplest way is to just always wear a mask correctly when you go outside during a smoke period. I think one of the big issues is that a lot of people wear their masks incorrectly. They're not tight. You need to have it like almost hurting so that there's no air getting inside. And so I'm not sure if just some kind of simple multiple language education on how to wear a mask correctly, because I think that is, you know, masks are pretty low cost and you can often, a lot of agencies give them away for free. So if you can get a mask, then even just wearing a mask correctly makes a huge difference in terms of how much you individually breathe in. And then as I mentioned, I know California has been looking at ways to improve energy efficiency. And I think they're starting to realize that you can make investments in low income, or they need to make investments in low income homes to help this. But again, that's going to leave a bunch of people who are not homeowners out. So I guess I don't have a great answer, but my number one thing would be the cheapest and most protective option is to just always wear a mask when you're outside and have it on correctly. Because again, talking to the doctors that we collaborate with in medical school, they're constantly frustrated how many people wear masks incorrectly and in ways that make them ineffective.
Our next question here, and Katie, before I ask your question, just recognizing time, we've had almost about 20 minutes of the open Q&A. I'm gonna just double check with members of the audience who are not part of the forestry capstone class to see if there are any final questions from any of those attendees. If so, get them in the chat now or raise your hand, because we'll be wrapping up here with Sam in a moment. Since I'm not seeing anything coming through immediately, I'm going to ask you a question from Katie Lowe, who we met earlier. She asks, do studies that focus on impacts of wildfire smoke or PM 2.5 exposure on various populations in California also include data from houseless people or unhoused populations?
I would say no. And that's another group that is also, you would expect, because they're almost never inside, they're going to be particularly vulnerable to these impacts. So the one place where I'll say we do see a little bit of this is in the emergency room data. So we have one study looking at hospitalizations that happened during wildfire smoke. And one thing we see is that we do see an uptick in hospitalizations for people where the address in their file is NA. And so we think that that might be what's going on, but it's not coded specifically as someone being houseless. So we can't confirm for sure, but it does seem like those people are picked up when you are looking at emergency room entries. And it does seem like you see spikes, but we don't have, I don't think there have been comprehensive studies specifically targeted that group.
Thank you. So with that, we will say thank you from everyone to you, Sam, everyone that's here on the call now, and thank you to everyone for attending. I wish that we were in person so you could hear people clapping in real life, but and then we'll ask everyone in the forestry capstone class to stay on, and everyone else, we will say goodbye and see you in a few weeks for the next seminar.